Just take a second to really hear those words. That's Wanda Irving talking about the last moments of her daughter's life. It's just a completely devastating account, and it gets right to the very heart of the crisis we're going to break down today, a crisis that's happening right now to mothers all across the country.
Hey, welcome. In this explainer, we're diving deep into the U.S. maternal mortality crisis. And as you just heard, this isn't about abstract numbers. We're going to look at the real data behind the headlines and, maybe more importantly, the systemic issues that are failing mothers day in and day out.
To really wrap our heads around a crisis this big, sometimes you have to start with just one story, one person that makes it all real. So let's start with the story of Dr. Shalon Irving. Dr. Irving was, by all accounts, just brilliant. I mean, she was an epidemiologist at the CDC, a lieutenant commander in the U.S. Public Health Service, and her entire career was dedicated to fighting the exact kind of health inequity that would end up taking her own life. It's a tragic irony that's almost impossible to believe.
And here's where the story just becomes gut-wrenching. Only 3 weeks after she had her beautiful daughter, Soleil, Shalon died. And her death was later found to be preventable. It was from complications with high blood pressure that just weren't properly managed. She was only 36 years old. Her story, it's this incredibly powerful personal window into a massive national failure.
Yeah. See, Dr. Irving's death wasn't some freak accident. It's actually part of a pattern. And when you zoom out from her story and look at the national data, well, the picture becomes terrifyingly clear. This is a crisis that's been hiding in plain sight. I mean, listen to this from the Aspen Institute. The United States isn't just doing a little worse than other countries. We are the absolute worst among our peers. We have the highest rate of mothers dying, and get this, while every other developed nation is getting better, ours is actually getting worse. How is that possible? And right at the core of this whole crisis is this one staggering number. A Black woman in America is three times more likely to die from a pregnancy-related cause than a white woman. And this isn't about money or education. This pattern holds true across every single socioeconomic level. It's undeniable. And look, this chart really shows you just how far off the rails we are. The US rate just towers over countries like the UK and Canada. It proves that these deaths are not inevitable. Other countries have figured this out. They know how to protect their mothers. So the real question is, why haven't we? All right, so to answer that question, why us, we have to dig deeper. We have to look past the hospitals, past individual doctors. The research points to a much more fundamental cause, something that's literally baked into the systems that we all live in. The term for it is structural racism. And it's really important to understand this isn't about calling one person a racist. It's about how our big systems like housing, education, and of course healthcare were built in a way that over time creates and reinforces inequality between racial groups. It's in the very foundation. I know what you might be thinking. This sounds kind of vague, right? But it's not. Researchers have actually figured out ways to measure it. They pulled together data on things like housing segregation, income gaps, and access to education to create a score that basically shows the level of systemic disadvantage in a community. And here's the kicker. Look what happens when you compare that score to people's health. A recent study on heart health found that in neighborhoods with the highest levels of structural racism, the risk of high blood pressure was 37% higher. The risk of diabetes, 80% higher. And stroke, a shocking 99% higher. It shows how this stuff literally gets under your skin, creating the chronic stress and disease that makes something like pregnancy so much more dangerous. Okay, so let's connect that big picture idea directly to what's happening inside the doctor's office or the delivery room. How does this huge systemic problem actually play out for a person who's pregnant?
Well, the experience of Serena Williams is probably the most terrifying and perfect example. After she gave birth, she knew something was wrong. She has a history of blood clots, she felt short of breath, and she told a nurse exactly what she needed, a CT scan and a blood thinner, now. But the nurse just thought the pain meds were making her confused. She literally had to fight to be heard. As she said later, I was like, listen to Dr. Me. I mean, come on. If Serena Williams, one of the most famous and powerful women on the planet, isn't listened to, what chance does anyone else have?
And it's not just about not being heard. The system itself is set up to fail. First, you've got what's called insurance churn, where women lose their health insurance right when they need it most. Then there's the postpartum care cliff. In many places, Medicaid cuts off just 60 days after birth, but guess what? A huge number of maternal deaths happen after that. And on top of it all, you have provider burnout, especially among Black doctors and nurses, who are a lifeline for so many patients but are dealing with their own discrimination and burnout.
And you know, our whole philosophy around birth is part of the problem. Here in the US, we're all about this physician-led, intervention-heavy approach. But in so many of those countries with way better outcomes, they lean on a midwifery-led model. That approach focuses way more on the birthing person, on shared decisions, and it's linked to way fewer interventions and happier, healthier parents.
Okay, so the situation is clearly dire. But, and this is a big but, it is not hopeless. Not even close. The problems are really complex, but the amazing thing is, the solutions are actually known. Experts have laid out a really clear roadmap. So let's look at 5 big ideas for how we can fix this.
So here they are, 5 game-changing strategies. First, invest in community-based care, like midwives and doulas, who can provide that personalized support. Second, guarantee health insurance for 1 full year after childbirth. No more of that dangerous care cliff. Third, diversify the workforce. We need more Black and Indigenous doctors and midwives, because we know that improves outcomes. Fourth, change how we pay for care. Reward hospitals for keeping mothers healthy, not just for doing more procedures. And finally, number 5, make this a real national priority, with actual accountability from the very top.
Wow, we have covered so much ground here, from a single, heartbreaking story all the way up to systemic failures and, thankfully, a real path forward. If you think breaking down complex issues like this is important work,
then the absolute best way you can support what we do is to hit that subscribe button for channel name. It truly helps us keep making explainers that matter.
So we'll leave you with this one final thought to chew on. The roadmap is there. The data is crystal clear. We know exactly what we need to do to save mothers' lives. The only question left is not about what to do, but whether we as a country finally have the collective will to actually do